I wanted to bring in some of your other Beat HIV CAB members now, because I know we have some research that was done there in Philly that we want to talk about with the perspectives that people who attend the HIV clinic there in Philly have about cure research. So thank you, William, for joining us. And Christopher, are you there?
Yeah, good afternoon. Thank you all.
Hi.
Hey, Chris.
Good to see everybody.
Welcome.
Thank you for William. Thank you so much. We're also lucky on the Beat Cab to have Stephen and William as our co-chairs, and the energy and the inspiration that they're bringing to the cab has been really wonderful. So I'm able to share my screen, correct? Is that right?
You should be able to.
Yeah. All right, so this is a presentation that was developed by the BEAT-HIV CAB. We're based in Philadelphia and work with Star Institute, University of Pennsylvania, and Philadelphia Fight, which many of you who have been in the HIV world for a while are aware of Philadelphia Fight as one of the leading community organizations and activist organizations in the field of HIV and AIDS. Our presentation today will be delivered by three of us who are members of the CAB. We have Stephen Johnson, who is chair of the BEAT HIV CAB. He's also coordinator of Project Teach Outside, which is a program of Philadelphia Fight that trains people living with HIV to be health educators and advocates in communities that are most hard hit by the pandemic. And the program not only focuses on prevention and treatment education, but also in developing advocacy and the next generation of advocates and activists. Dacre Robinson is also a member of the HIV CAB. She and I have been members of the CAB since the CAB was first initiated in 2017. She's also a well-known leader in HIV in Philadelphia. She's chair of the Center for AIDS Research Community Advisory Board at the University of Pennsylvania. And she's also currently director of long-term housing in the city of Philadelphia. And I am a member of the HIV CAB, and also I'm a medical anthropologist and work at Cornell University, and also adjunct in bioethics at Temple University. All right, so I want to give some special thanks to the organizers and sponsors of this wonderful, fantastic, and invigorating conversation today. So big love to Richard Jeffries and Treatment Action Group, also to other co-sponsors, including ATAC and ABAC, Fred Hutch, and the variety of Martin Delaney collaboratories that are here today, including DARE, Defeat, BEAT, and also I4C CABs. Again, mad love to Danielle and Michael for co-hosting and really holding it down. And today's presenters that we've had already. Thank you so much, Lori. It was an amazing introductory on cure research. Thank you, Simon, so much for your work. And of course, William B. Carter, again, it's always a pleasure and honor to hear your story and your inspiration. Our presentation today, we're going to talk a little quickly about the Community Advisory Board as one way that that members and other stakeholders can get involved with HIV cure research. We're going to talk about the role of social sciences in advancing HIV cure research that is ethical and community focused, and also focused on research justice and health equity. So we're going to do a case study of awareness of HIV-corrected research. It's a survey of 100 HIV clinic patients in Philadelphia, and it's sort of the beginning of a variety of social science projects that we're working on with BEAT. And then we're going to do just a quick run through of some of the social science working group projects and initiatives that we've taken on. I want to also give mad love to Corinne DeBay, who's been a consultant and a researcher on all of these projects, and it's been lovely and moving to be working with her. So first, about the BEAT HIV CAB, I just want to share our vision statement. Our vision is that we live in a world where HIV and AIDS research meaningfully involves affected and impacted communities, is collaboratively created and openly shared. So you see how important community engagement has been to the foundation of our CAB. And our mission statement is, as a Philadelphia-based HIV cure Research Community Advisory Board, our mission is to integrate community involvement in HIV and AIDS cure-related research and clinical trials, to also serve as a bridge community, to provide input and feedback to BEAT HIV projects, and to foster and maintain communication and partnerships with project researchers in order to advance transparency and disseminate findings in our communities. We also have developed what we consider to be a really pioneering model of collaboration between three different teams or partners. The first is the Community Advisory Board, which I mentioned. We also partner with a community-based organization, which I've also mentioned, Philadelphia Fight. And also we partner with our scientists. And this partnership we call the Community Engagement Group, that brings together scientists and community-based organization and the CAB to advance HIV research, and also to demystify what HIV cure research is. I know we all have many, many questions. Even those who have been working in the field for many years have many questions about clinical trials. And so our role is to demystify the process. But we try to strive for an equal partnership between the Community Advisory Board and the community-based organization, and also our research partners. Our CAG members, so our Community Advisory Group members, represent a range of what UNAIDS would refer to as key population, and also a variety of skills and expertise, such as people living with HIV, long-term survivors, cure research participants, Black women, substance users, same-gender loving communities, transgender communities, also health providers and other researchers in our local community. So we bring together in our CAB, again, a wide range of skills and expertise and knowledge. So the first case study that we want to talk about in terms of the role of social sciences in advancing cure research and the importance of incorporating social and behavioral sciences at all levels of cure research. We're going to start with a study that we conducted in Philadelphia beginning, I think, 1.5 to 2 years ago. And the title of this study is Awareness of HIV Cure Research, a survey of HIV clinic patients in Philadelphia. And here I'm going to hand it over to Stephen Johnson.
Good afternoon, everyone. I'm glad to be here. And before I go further, let me acknowledge William Carter. William, I am very, very proud of you, and I appreciate you so much, and also every member on our CAB. I'm going to go ahead and get started with the background. The BEAT-HIV CAB initiated and guided the survey questionnaire, data collection, and interpretation of results. This data is needed to guide the community engagement, content, and delivery for the purposes of outreach, recruitment, and community education about cure-directed research, which centers the voices of communities most affected by HIV and are underdeserved by current research efforts. Access, willingness, and barriers to participation. Next slide. Objectives of our survey. We measure the current awareness of cure-directed research, understand perceptions and misperceptions of the research, and access willingness and the barriers to participation. Next slide. The purpose of this survey was to provide data to help guide the community education and engagement efforts, design meaningful messages, identify more effective delivery strategies for HIV cure-directed research, recruitment and engagement, responding to the needs of affected, impacted, and underdeserved communities, advance meaningful community education and engagement. Next slide. The questionnaire design is voluntary and anonymous. This was done before or after the appointment, and it was brief, of no more than 10 minutes. We done this confidentially in the clinic setting, and it was web-based direct data entry using just a tablet. Next slide. Some questions that was on there. Have you ever participated in a research study? How willing would you be to participate in research to find a cure for HIV? Or do you think a cure for HIV is possible? And those are just some of the questions that we asked. Next slide.
Great, thank you, Stephen. And now on to Daiquiri.
Thank you.
Hello, everybody. So this is some of the things that we found when we did our survey. Again, we used 4 clinics in Philadelphia that were surveyed. Both were community clinics as well as university health centers. There were 100 respondents. What we see is that people living with HIV and AIDS in Philadelphia pretty much mirror our survey respondents. But we want to take a look at, can you go back for a second, Chris?
Sorry about that. Yeah.
We want to take a look at not only our female categories, but also the Latinx categories. These are folks who we see that we need to do more not only research with, but as well as outreach to make sure that they're going to clinic and going to the doctor as necessary, and also to make sure that they're keeping their health up to date, as well as giving them information about research study. Next slide. 76% of the folks had heard about cure-directed research before, either from clinic staff, television, and things of that nature. But look at social media. Social media and websites equal 22%. But when we look at social media at 10%, look at us now being locked down for COVID. And this survey was done pre-COVID. So would the social media increase because of COVID if asked the same question? And also for websites, we want to know, we may drill down even more, what websites are people being directed to, or what are they looking at in regards to cure-directed research? Next slide. 85% would like more information about cure-directed research, and they feel that the best source is the doctor. But we also want to take a look at the case manager. Only 9% feel confident that their case manager is the best source. So does that mean that the BEAT needs to do more, more investigation on educating case managers and other community members and social workers around cure-directed research and how it can be helpful? Next slide. 86% were willing to consider participation in cure-directed research. And some of the factors that were influencing their willingness was the provider's opinion, the impact on their treatment, time commitment, travel, invasive procedures, compensation, and again, when it comes to women, childcare. Again, this is something that we may have to drill down into even more, because again, most women, and I'm speaking for myself, we take care of everybody else before we take care of ourselves. So this is something we want to take a look at in a further survey. Next slide. What best describes your belief about a cure? Some say there'll never be a cure. Some believe someday, but take a look at those who believe that a cure already exists. And we were talking about this earlier, how folks actually believe there's already a cure, in the same way folks believe that Magic Johnson was cured, that because he had fame and notoriety, he was able to get medications and he's cured of HIV. So some people really do believe, but what we need to figure out and find out is, what does that mean to them? What are some of the reasons why they think a cure already exists? Next slide, Chris. So the summary we have is, most clinic patients in Philadelphia are aware of cure-directed research. About 85% want more information. The providers are the preferred source of information about cure-directed research. And while most participants believe a cure was possible, we still have that 41% that believe that one already exists. Next slide. So some of the next steps we would like to take with this particular survey is to tailor a similar survey for the HIV care providers to measure their awareness of cure-directed research amongst healthcare providers, as well as understand their perceptions and misperceptions of cure-directed research, and also to assess their willingness to recommend patients to cure-directed clinical trials. Again, reaching out and doing outreach in the community, so that way people are more informed, so that we can get more people who are willing to do cure-directed research. and be in the trials. Determine best practices for partnering with HIV care providers. And number two, to employ in-depth qualitative research methods, interviews with HIV clients and patients for exploring the provocative finding about why do they believe that there's already a cure. That's one of the biggest things we want to make sure we talk about. Go ahead, next slide.
Thank you, Daiquiri. And I'm going to do a quick conclusion. Thank you both, Stephen and Daiquiri. Hope you all see what an amazing, robust, energetic cab and brilliant cab we have. So just a couple things about, so part of the BEAT HIV CAB, we have a social science working group that's made up or comprised of most members of the CAB. We're learning from and engaging in research that really is based upon this wonderful article that was published in October 2019. Corinne Dubé is the lead author. And the article provides a wonderful framework for how to apply the behavioral and social science research to HIV cure research. And a couple quotes I just wanted to pull from to sort of help ground what the social science working group and our initiatives are being guided by and building upon is that social and behavioral research provides an improved understanding of the human and social dimensions related to cure research. And then also part of social science and behavioral sciences is the role and the necessary ingredient, which includes community engagement and meaningful collaborations among people living with HIV, study participants, providers, researchers, and bioethicists. And one thing I want to underscore that Stephen was talking about is that the questions that were developed to interview clients and patients at HIV clinics in Philadelphia, the questions were created and developed and revised by the Community Advisory Board. So we really were building upon all of our expertise and our experiences and really pulling from some of the work in public health, which is known as community-based participatory research, and having communities really at the center of designing questions and the analysis of data that will be meaningful and relevant to those of us living with HIV and other impacted communities. So some topics that the article mentions, and I'm just going to name a couple, that social sciences are really helpful and necessary for us as we move forward with the HIV cure research agenda, is to think about how language and communication affect the meaning of cure. Lori talked about this earlier today in her opening. Also, how cure affects the identity and social position of people living with HIV. Also, the social and behavioral sciences allow us to think about and explore the motivation, accessibility, and decision-making practices of potential study participants. Also allows us to explore people's thoughts on social harms or adverse social effects associated with cure research, and also provide lessons and ideas for how to scale up any proven cure strategy in the context of stigma, discrimination, economic inequalities, and other social inequities that of course drive the epidemic. And again, I want to really thank Corinne Dubé and her co-authors for this wonderful article. So a couple projects that the Social Science Working Group has already completed is we developed an HIV cure educational video series. And perhaps Beth, since you're on the, can you put the link to the video series in the chat box for everybody? So the Cure educational video series is really, and to our knowledge, one of the first of its kind view of people in Philadelphia moving towards an HIV cure. People who were interviewed include people living with HIV, cure research trial participants, healthcare providers, researchers, and the broader community as well. And we developed 4 different videos. The first is Game Changers, which is really an introduction to who and what is behind HIV cure-directed research. We have the top 10 issues and items and questions that you might want to consider as you think about participating or not in a HIV cure directed trial. We discuss the art. We discussed the art of ATI, so analytical treatment interruptions, what to expect, what is an analytical treatment interruption, and why are analytical treatment interruptions included in cure research studies. I think that's one of the questions that all of us in the community doing this research and this advocacy get, is why would I go off my medications in order to do an HIV research trial? And also the time and commitment. So some of the issues that Lori brought up, some of the issues that William brought up, and some of the issues that Dacre brought up as well are addressed. And please share the videos among your networks. The other project that we that we just completed is the BEAT-HIV position paper, which is entitled Joining Forces to Advance HIV Cure Research. It is a document that was created by the Community Advisory Board and also the Community Engagement Group with significant community engagement. The paper seeks to inform a diverse range of stakeholders to advance HIV cure-directed research, literacy, by engaging potential study participants and their communities, HIV researchers, healthcare providers, et cetera, as we advance the search for a cure. And then also just wanted to mention the table of contents and some of the issues that we take on in this quite extensive position paper are. Bring your eyes, if you can, to module 1. So we began talking about what is an analytical treatment interruption, what are how and why are ATIs used in HIV cure research. We discussed considerations for participating in cure-directed studies. Another module includes considerations for navigating the informed consent process. And another module includes additional social and health implications to consider as you enter or consider being a part of an HIV cure-directed clinical trial. Here we discuss not only behavioral and psychosocial issues, but also issues of stigma, social inequalities, and also the criminalization of HIV as well. And then our module ends with a consideration of the issues that are facing women in being engaged and also recruited and being retained in cure-directed clinical research. And then we also have a Bill of Rights and Responsibilities that we would love for to share far and wide for both researchers and participants to know what their rights and responsibilities are when they enter an HIV cure directed clinical trial. And just to sum up, we have at least 2 ongoing projects in addition to the projects that Dacre spoke about. We are an ongoing project is entitled Participant Experiences in Cure-Directed Research. So we're conducting in-depth interviews with clinical trial participants in BEAT HIV trials. We seek to gain a richer understanding of cure-directed clinical trial participants' experience. Also, one of our goals is to uplift community expertise and voices in the development of data collection tools and methods, as well as in the analysis and interpretation of data, and also inform HIV cure investigators with recommendations for best practices in the conduct of HIV clinical trials. And I think, as you can see, with all of these projects in the Social Science Working Group, we are really trying to center and uplift the voices and experiences and wisdom and knowledge of community members and people living with HIV and folks from very highly impacted communities as well. And another project we're working on, which is really just beginning, is we're looking at conducting in-depth interviews to understand how people living with HIV who participate in HIV-directed clinical trials experience and think about and perceive a home-based viral load testing device that would allow people and would allow us to take a sample for viral load testing from our homes rather than going to a clinic. And I think this is really important for many different reasons. It's something the community has long advocated for. And also in the time of COVID, as we've talked about earlier today, the importance of engaging in practices that will reduce the possibility of COVID's transmission. And I just want to give big thanks and big love to all the members of the community engagement group. The members' names here who are bolded have been members who have been working on the social science working group for a long time. Again, I really want to highlight the work and expertise and the collaborative spirit that our CAB has had working with Corinne Dubé, who's really been one of the leads in our research projects. Of course, we want to thank our supporters and funders, with Star Institute, Philadelphia Fight, UPenn, and the Philadelphia Foundation, as well as the NIH for the funding of the Martin Delaney Collaboratory. And here, if I could just bring Stephen and Daiquiri back in, we had some questions for discussion and look forward to taking your questions. I know this was a quick run through, but we're very excited to have shared all the multiple projects that we're working on.
Thanks again, Chris and Stephen. Some of the questions we wanted to have for discussion, and I know you all want to put some of those answers in the chat for us. What are your thoughts on the topics that we covered? What role do you think social sciences play in advancing search for HIV cure? And what did we miss? What other studies do you want to see information on?
I have, I don't know if it's a question or a statement. What did you miss? I think that people are talking about it, but are missing it. And I don't know if it's because it might be seen as trying to coerce someone, but I think that everything else has had an increase. But what they haven't done to seek out, people to do research testing, I think they need to increase their limited amount of money that they're doing. And even for community members who serve on the boards, most of the community members work more than an hour and a half a month on doing stuff. But the amount of compensation that is given to them is basically, I personally feel as though it's truly an insult to do that. You want members to sit on the board. You want quality people to sit there, but yet you offer them money to do nothing. You basically give them lunch money. You don't even give them enough for parking, which you do. But I think that should be talked about and brought up to the NIH, because they get an increase every year or every time their contract is renewed. So how would they feel if I offered them $10 or $15 for their particular time at their expertise? I want to put that out there to everyone to discuss.
Yes, let me put a pause on this for 1 second because we are over time now. And I want to allow still the conversation to go on, but I wanted to make sure that everyone realized that if they cannot stay on anymore, it is okay to sign off because we are indeed over time. I see your question marks.
I hear you.
So I wanted to make sure that we all realize that tomorrow, hopefully you saw in the chat that we have our feedback form for today's session, which you can fill out, and that is the way you will enter the raffle. Giving us a feedback form will get you one entry into today's raffle. There will be 5 winners for today's session. So again, I wanted to continue on and have this conversation, but if people need to leave, please feel free to sign off and leave us your comments if you want to before you leave. Thank you very much, everyone. So go ahead. And William, I love that idea of asking them how much they would like $10 or $15 thrown at them. Obviously, I think we know they wouldn't. Mark, did you want to ask your question out loud? You can take yourself off mute.
I just want to make a quick comment. I noticed that like over 80% said the best source of information in terms of joining a trial is their doctor. And, doctors play a great role, but I actually disagree with that. I think those of us who are community health educators are much better at that for 2 reasons. First of all, doctors don't have like a half an hour to sit down and explain what the treatment is being tested, what the cure is like, what the risks and benefits are. And secondly, they're doctors, they're not educators. So many of us go to our doctors and they don't know how to explain things and they use a lot of jargon. And everybody on this call who is a community health educator knows how to do an amazing job of explaining the science, of lowering the reading level. And I hope we just all can send the message that if people want information on, how to decide to join into a clinical trial, they should find a community educator, because of course they have to speak to their doctor. That's critical, but I think you need to supplement that with all of us in this chat and elsewhere who are on the ground explaining these things in language they understand. Does it make sense?
I think it makes total sense. I think it's a vital role that we play as the sometimes the translators for things that are in need of translation, as well as also just someone else that they can bounce ideas off of. I mean, their doctor has a position of authority sometimes, and when you are just a peer educator or a health educator, you're not necessarily in direct care for that person, but might be able to be a sounding board for their thoughts of what they've heard from their doctor. So I think we play a vital role in this conversation.
I myself have learned a lot from the UW CAB meetings and other support groups that I attend in this, to understand and better understand and be able to explain to my peers what's going on in research and how it can help me or others in our community. So I value these presentations for that education. And you guys do put it in very good terms to be understood.
Great. So did we have any other questions that people want to bring up? I know you guys had questions. Did anyone want to answer any of the BEAT-HIV questions? Your thoughts on their topics, or what roles the social science might play, or anything that you think they may have missed, what other studies you would like to see them do?
Mark, did you have another question, or did you forget to put your hand down?
I forgot. I'll put it down.
Thank you.
And I think Mark makes a great point, and I think maybe we can do better as well in terms of raising the awareness that community educators are out there as a resource. And to get to the questions here, I think social sciences can play a really key role in helping us better understand how people are experiencing cure research and the information they have about it. It was maybe a little slow, and I think Corinne in particular, but also all this work that's been described here, and that some of the other CABs are doing as well, has really helped raise the profile of social science and bring it more to the fore since the collaboratories were first funded.
Yeah, thank you, Richard, and also thank you, Mark. We will take these questions as we move forward with our social science initiatives. And just to underscore, one of the things that's been so wonderful and robust working with Philadelphia Fight is that we do have trained educators like Stephen, who just gave the presentation, who are engaging in this in these educational practices. So we really appreciate the need for a diversity of voices to advance literacy and education. So thank you.
You're welcome. And I have one last question for y'all. Is the BEAT-HIV CAB on social media at all anywhere?
Yes, we are.
Great question.
We have a Facebook page, and we also have a website, and probably call upon Beth if she's still here. But yes, you can find us on Facebook. There's also, yes, I will also post it. Beth, are you still here? Because I think our PI, Luis Montaner, has also the Wistar or the Montaner Lab.
Yes, he's on Twitter. Mm-hmm. Yeah.
So, and we also have what I think is our wonderful website, which provides both the videos and the position paper as well.
Excellent.
And I think maybe if people have additional thoughts that occur to them about the questions that you raised here, they can follow up, get in touch with you via those websites, right?
Yes.
Great.
Thank you for that.
The way that I ask the cure question, by the way, is always, do you think a cure exists but is being deliberately hidden? That kind of rules out the Timothy Ray Brown thing, you know? So that's the way I ask that question.
Thank you, Mark. I don't see any other chats or posts. Thank you, Michael, for posting the session 1 feedback form. Remember, folks, if you complete today's session feedback form, you will be officially entered in the drawing to win 1 of 5 $50 Amazon cards. With that said, thank you everyone for attending today. Join us tomorrow, same bat time, same bat channel.
Got
Any
it.
closing remarks? Michael, Richard, anything I forgot to mention here?
Danielle.
Thank you, Danielle and Michael, for being the hosts with the most.
Yes, you got it.
Happy to do it. Till tomorrow, folks.
Till tomorrow.
Thank y'all. Y'all have a
Thanks
good day.
all.
Bye-bye.
Thanks
You
everybody
too.
for joining.
Thanks, everybody.